My name is Andrea. I'm in the Brownsville clinic. We opened up in 2013 in the fall. It was the recovery center before that, and it was run by the county here in Lewis County. At any given time, we have admitted clients, between 60 and 70 clients that are admitted into the program. When you factor in clients who are in the pre-admission process who have not been admitted into the program, we consistently have between 90 and 100 clients in our clinic at all times. So, given the 10 clients that were in the clinic prior to Credo coming in, there's significantly more people getting services in the county. We run a lot of groups, and so clients are able to come in and come to group 5 days a week if they need to, and can get individual sessions. We meet with them every week if they need that. We can offer mental health if they need that as well. We cannot prescribe mental health medication at our Baldwin site. In Watertown we can, so if they want to have all of their services under the Credo umbrella, then they would have to go to Watertown for that. So what you were saying about, kind of just touching on what you were saying before I talk about our other services that Credo has. Treatment is difficult. It's not, and not from a perspective of a counselor, because we come in every day and we do our job. We do our job the absolute best that we can. It's hard for people coming in, just like it's difficult for Scott to come up and tell his story for the first time. It's hard for an individual coming in for the first time. We have a lot of clients who are mandated to be there, who don't want to be there. It's hard for them to come in and feel that that is what they have to do. You can't force somebody to do treatment. You can't. They're not going to get anything out of it. Loving somebody and talking to them and having that person decide for themselves that they want to get treatment is going to give them the best outcome and will have the longest lasting effect on their life and your life as somebody who loves them. So it's somebody who is using impacts not only their lives, but there's such a domino effect. At any of our outpatients in Watertown and in Lowville, we can take in clients who are not using. So if you have a significant other who is using, the significant other may not want to come in and get counseling for themselves because they're shooting up 10 bags of heroin a day. And that's fine. If they are not ready to do treatment, then that's up to them. You can't force them to do that. If you want to come in for treatment for yourself, because that person using is impacting your life, you can come in to an outpatient clinic and get treatment for yourself because that impacts your life. And we would do a treatment plan for you just like we would for somebody who is using. And we would gear your treatment plan around how addiction is impacting your life. And we would have individual sessions for you to talk about your life and how addiction is impacting your life. Because addiction is not just about the person using at all. We have clients who are adolescents coming in from schools, not even necessarily referred by schools, but from CPS or other situations that it impacts the kids, most definitely. Same with the kids. It has a huge impact. Just like what Mountain View does, we want to help prevent those things, the cycle. trying to break the cycle if we can. Having them talk about how somebody using in their life, how that impacts them, helps them see how they don't want that to impact their life moving forward. So anybody can come into treatment, whether they're using or not. If addiction is impacting your life in any way, then we can help. We also offer a family support group. It's free for anybody in the community. The first and third Thursday of every month at 5 o'clock. You don't have to have anybody in treatment in our clinic to come. It's for anyone. It doesn't cost anything. It's all confidential. You come in and talk about whatever you need to talk about. And the group moves from there. Anybody in the group, whatever issues you're having from one group to the next is what's discussed. And it's a great way and mostly it's parents that come, and it's a great way for parents to talk about what they have dealt with their children who are using, because there's a gamut of where parents have been. There are parents who come to the group that they have children in recovery. There are parents in the group who have actively using children. There are parents in the group who have children in long-term inpatient programs, and they're wondering what to do when their child gets out, and all of those kinds of things. So it's a great place for people to learn what worked for you, what didn't work for you, what should I do, what shouldn't I have done, a lot of guilt goes on with those kinds of things, because I have 4 kids, so you parents tend to carry that burden that, if anything goes wrong with your child, somehow it's your fault. So it's nice to be able to have somewhere where you can go to be able to talk with people and be able to work through all of that. Your kid, just like anybody else, makes that first choice. And at some point, addiction takes over, and it's not a choice anymore. And that's part of the education that people need to have, is that just like what he was saying with the brain or pain, at some point you have to have it. You have to have it. There's no other option. So those are the services we have here in Lauga. We can do mental health. We can do substance use, obviously. We have family support. We have a 7 Challenges. It's called 7 Challenges. It's our adolescent program. And it's for anyone 21 and younger. And the program was developed specifically for adolescents, and it's tweaked slightly different for adolescents. If you have, I won't get into all of that. If you have questions, we can talk about it later. But it's a really cool program, and it works really well for the adolescents, and they enjoy it. And then in Watertown, we offer another outpatient program, which is about 3 times the size of what we have here in Alva. We also have mental health counseling. And then last fall, we opened the opioid treatment program, which offers daily methadone dosing, Suboxone, and Vivitrol, all for opiate users. And it has had quite a significant impact on the community. If you're not familiar with methadone or Suboxone or Vivitrol, it's pretty impressive. And if you have questions about that, I would be more than happy to tell you about how they work, how they're different from each other. There are Lewis County clients who make the trek every day to Watertown. Because before Credo opened up the opioid treatment program, there were people driving to Syracuse every day or to Plattsburgh every day to be dosed, because those were the closest facilities they could get medication. And then we also have 2 halfway houses for men. Halfway houses are when clients come out of inpatient programs, and then it's basically like a step down. So there's still there's structure, they have somewhere to live, and they have rules to follow, they have chores to do, they have to make their own meals, they have to learn how to do their own laundry, and all of those kinds of things. And a lot of times, they've never had to do that before. So we only have halfway houses for men. Finding a women's halfway house in the state of New York is very difficult. Not sure why, because women need it as well, but they're really hard to come by. We have a women's intensive residential program, which is a 9 to 12 month inpatient program for women. They live in the house, they get all of their treatment in the house. If they have a child under the age of 3, they can have their child with them. And it's an impressive program. They do wonderful work there. And then our last site is the farm. It's the RRSY, it's the adolescent male site. It's for males 21 and younger, and it's an actual working farm, and I think it's the coolest site we have. They do everything on the farm, and I think it's the neatest way to learn life skills. They do everything there. Usually when they leave the farm, they go to one of the halfway houses, because the farm is typically 6 to 12 months, depending on what they need. Everything is individualized. They usually step down then to a halfway house. But most clients come to the farm from all over the state, because there are not very many adolescent facilities. So they usually step down to a halfway house. But if you ever get a chance to go to the farm, it's pretty. Anybody have any questions? I am so much better with asking questions. That's all of our sites. We do a lot. And I understand your frustration with the detox. It's a frustration we have. There are only 3 detox facilities anywhere near here. There's Canton Potsdam, there is Conifer Park, and there's one in Syracuse at Syracuse Behavioral Health. But none of them have very many beds at all. They're all so very limited. They're very selective on what they will even take you for detox. You're not going to die from an opiate withdrawal. They're probably more concerned about benzos, because you can die from benzo withdrawal and alcohol withdrawal. And so Xanax definitely would be a concern. You're going to hurt with an opiate withdrawal. Really, that's smart. But like you said, Camp Potsdam, 6 beds. Syracuse Behavioral Health is the same, and Conifer Park may not even have 6 beds. It's definitely a need that the whole area needs. And that's kind of where the opioid treatment program comes into play too, because people who are using opiates, when you're in the early stages of withdrawal, that's the time that you would be put on methadone or Suboxone, and that would stop the withdrawal, and that would be a maintenance program that you could be put on.
Yeah, I had to be sick before they would take me.
Yep,
was sick when I was talking to him.
Yep. And you can't use again until, and then by the time you can get a bed, it's so far out that you
You'd be
would
over
be
being
detrust
sick.
on your own. Right. I know. But we have to fight insurance, we have to fight to get the days that we need. Because a 28-day inpatient program is not 28 days anymore, we're lucky to get 14. We need longer inpatient, and those are all things that are out of our control at an outpatient level. We can only make referrals. But there are meetings going on in Lewis County all the time. I think I was at 4 last week. So there are a ton of things happening in this community. I love this community. There's a lot going on here because there needs to be something done. So I want everybody to know that there are a lot of people working behind the scenes that you don't see to try to make things happen. But unfortunately, it's not something that's going to be fixed overnight. But there are a lot of people working to try to make things better sooner rather